Dear friends, an interesting case of lentiform bleed, and we had to do targeted embolization of intranidal AVM aneurysms. CT scan shows the bleed. CT angio shows the large diffuse AVM all around the hematoma. This is a detailed 3T CD angio, which helps to analyze the as to how the AVM is, where are these ruptured aneurysms are, and what we could clearly see that there were two intranidal aneurysms just around the hematoma, and we know these are our rupture spots. Now, problem is catheterizing these feeders. Lenticular feeders are always challenging. Sometimes we use balloon, what microcatheter to use, and how to glue them safely. The angiogram again shows those two nidal aneurysms which are on a perforator. We can see them on the lateral angiogram, large diffuse AVM. So the plan is targeted embolization of the AVM. Distal access is very useful. So we used a distal access Sophia catheter here in the supracolumnar ICA as a guiding catheter, so as to have very fine control. We tried microcatheter placement, but you can see because the reverse origin of the perforator here, we could not get through it. So what we decided to use was balloon assistance. So balloon was taken just distal, overlapping the origin of the perforator from here. And then we placed the microcatheter. Here also you see it sort of forms a loop, and then we could go in at least as safely so as to make the embolization with glue safer for the patient. Here we can see we reached quite deep. And beyond that, it was challenging to take it further. Microcatheter injection showing the nidal aneurysms clearly. And so we use diluted glue to embolize. We can see the glue entering the aneurysms as well, and occluded the parent vessel. Post-op angiogram shows preserved arteries with no evidence of the aneurysms. This is the post-op CT shows we use diluted glue, a diffuse embolization of part of the AVM as well as the nidal aneurysms along the wall of the hematoma, and patient did very well. So all embolization are not same. Your goal has to be clearly defined in these patients. What we want to achieve here, we were very clear. We only wanted to embolize the aneurysms. Strategy to catheterize perforators is challenging. We have to use balloon assistance, and glue technique has to be very precise here, because you don't want to reflux into these perforators too much, while at the same time get the aneurysm as well. And I wish to thank you for this short recording, if you can see it, and we can all share our knowledge on this basis.